Today's COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.
And we're back. And we're moving into our first conversation for this morning. It's our COVID-19 update. And we are focusing on the COVID-19 vaccines and trying to get a better understanding as to what's available and what we know so far. So we're joined by Internist at Belize Healthcare Partners, Dr. Jorge Hidalgo. Good morning.
Good morning.
Good morning, and thank you for having me again.
Okay.
And now, Doctor, internationally, of course, we've been hearing about the vaccines for a few months now, and we are expecting to get Belize's first rollout in the next few weeks. But of course, the discussion surrounding a lot of this vaccine has been, of course, met with some controversy because of the speed of the rollout, among other factors. Now, let's start our conversation just by having a really general conversation about vaccines this type of vaccine and how it is they actually work before we talk about the specifics of the Belize's one.
No problem. Well, as I mentioned, I want to start saying that before we can go into that, we need to say that our body have their own armamentarium, if you want to put it that way, that help us to defend us against infection. When our body is attacked by either a bacteria, virus, we have the elements to essentially fight it, and then basically our body do that we can say a clearance either of the virus, and if we have a bacteria, they probably will need an antibiotic to facilitate. The vaccines essentially are developed with the idea to provide us with a certain material that it will help our body to fight the virus without us get infected or get the sick, if we can put it that way.
Mm-hmm. Now, so what we're trying to do with the vaccines is trying to get our body to build up a defense before we come in contact with COVID. Let's try to go through what we know so far by the vaccines that are currently being rolled out. We hear of three popular ones, of course, Moderna, Pfizer, and AstraZeneca, but there are others around the world that are also being used as well.
Yes, that is correct. And then just to give you a general idea, as I start with our own immune system response, because what is the intention with the vaccine is trying to deliver or find something to deliver this type of information into our body. That way our body, it will recognize the virus when it's the time and fight it. And in order to do that, there are several technologies that are being used. Mm-hmm. And I will go with the less popular to the most popular.
Okay.
We have some vaccines that essentially uses proteins, the different proteins of the SARS-CoV-2, and then that they will, with some particles of the proteins, then have been introduced to our body, and then in the future, when we get in contact with the SARS, our body will be able to recognize and then fight it. Mm-hmm. We have also that we call it a viral vector vaccines that essentially uses some materials of the SARS-CoV-2 with the same idea to provide and to have some information in our cells. We have also that we call it an inactivate vaccines that essentially will use a kill SARS-CoV-2 virus, and also we have the attenuated or wicked SARS-CoV-2 type of vaccines that they will essentially do the same. Just use as a delivery into the cells. That way we'll be able to recognize. Mm-hmm. And then we have the most popular one, Pfizer and Moderna, that they use a genetic material. And essentially, this one uses a pieces of RNA, and then we call it the messenger RNA, that it will do the same. It will introduce certain material in our body, and then in the future, when we get in contact with the virus, then we'll be able to fight it. Those two are, of course, that have a most a rate of effectiveness, more or less between 94 to 95% in average, no?
Yeah. So Pfizer and Moderna use the RNA technology.
Yes, they use the RNA technology.
And what about AstraZeneca?
AstraZeneca we use something that we call it adenovirus. This is a type of virus it's a chimpanzee adenovirus. Mm-hmm. And then what the AstraZeneca uses is DNA material, more or less similar. Mm-hmm. Just instead to use RNA, AstraZeneca uses the DNA.
Okay.
And then with the same purpose, again, with this adenovirus, then it will basically use as a delivery car. And it will bring all the material to our cells, and then that we'll be able to fight the infection when the time comes.
Yeah.
And and you mentioned a little bit just now about the effectiveness of of some of the vaccines. And can you break down a little bit more about the effectiveness, just so that some of our viewers could understand, in terms of different strains and the effects on it, that it has on the body and fighting or preventing the infection?
Yeah, well, the idea essentially is to for the purpose of being approval, we need to have certain level of effectiveness that it essentially goes to 60% or higher, no? Mm-hmm. As an idea to be able to fight the virus. Like some of the vaccines have an effectiveness of 65%. However, probably with AstraZeneca, there are two pieces of information. The study was rolled out in the UK and also in Brazil, and very interesting. In the UK, for reasons that probably we don't know, the first dosage they use half of the dosage, and the second dosage they use a full dosage. In Brazil, they use 1 and 1. But interesting, the UK, the effectiveness went to 90%, and in Brazil was around 69, 66%. I mean that.
I find that so interesting, and we don't understand why.
We don't know exactly what happened in that. We probably we have more information about it and why this difference, especially in effectiveness, no.
So. That's important for us to know. As we've been informed, we're more likely to get the AstraZeneca vaccine as a part of our allotment from COVAX facility. But we've also been hearing more recently of the Sputnik 5, the Russian vaccine. What do we know about this one so far?
Well, as you know, the Sputnik vaccine, it came at the beginning with probably a lot of bad information, and then of course when we're talking about this type of vaccines, we want to have a more serious clinical trial that we can have a piece of information and say, okay, this is a serious report, and then recently we have the report that we was waiting, and especially came in the publication on the Lancet, who is a really very serious company, Polish company, and then they essentially show that the Sputnik vaccine, with the information we have, it provides more or less 91% of effectiveness. No?
Yeah, yeah. So that's important for us to know, because those are two of the vaccines that we are told we are more likely to get. Now,
that is correct.
Yeah. So when you and the Sputnik is also 2 doses?
Most of these vaccines are 2 doses, except Johnson & Johnson, who is a single dosage.
Yeah.
And that is important because when it comes to immunity protection, we need to have the 2 vaccines. We have the first dosage, and it will take a couple of weeks for the body to build the necessary information to fight against the virus when the time is coming.
What's the wait time between the first dose and second dose for the different vaccines?
It varies. No, there are some that is 21 days, some others 28 days. It varies, but in average, we can say between 3 to 4 weeks.
Mm-hmm.
And do we know about any side effects or complications of some of these? Because I think that's a big concern as well.
Yeah, that is a very important question, because first of all, there are no medication or nothing that we are going to get as an outside that is going to be completely free of side effects. Mm-hmm. However, what we've been noticing is one of the side effects that we see, especially with the RNA vaccine, is allergic reactions. Mm-hmm. Then we can have pain in the site of the injection, muscle ache, and in some cases we can have like a flu symptoms. We can put it that way.
Yeah. So, and I think that's one of the things that people pay keen attention to, because it is new. You may follow reports around the world, and you may hear of a particular population or a severe reaction. How do you put this into perspective as a medical professional?
I think so. One of the best things we can follow is the amount of vaccines that have been already administered. No? And probably the best example of that is Israel. No? Israel has been already vaccinated almost 50%, if not more, of their population. And you can see now they are starting to open and relaxing some of the measures that were implemented, strict measures that were implemented by the end of the year, no? Mm-hmm. With the intention to contain the pandemic. And then now that they have this successful rollout of vaccines, they notice an important decline in hospitalizations, and that at the fact that they are start to releasing and to start to open the countries step by step. No? Yeah. I think that's the best example, and also that in a way can give some assurance to our population that despite of everything, despite of all the information we can get, we need to have a more scientific information, making sure that we are doing the right thing. And then probably I will put in some of the things that you guys mentioned before, in the sense that one of the most concerning issues that the population have is that these vaccines were developing very rapidly, no? Mm-hmm. And some people say that probably without follow the appropriate protocols, but it wasn't the case. You know, the fact that we have the SARS in 2002 and 2003, MERS, and of course the Ebola, that in those type of situations, the scientific community already developed certain information that help in this particular scenario to the development of the vaccine, because we already have in a way some work done before that it helps in this time, and of course the vaccines were follow all the necessary protocols, especially for safety.
Okay. So in addition to being able to recognize safety issues that are taken into consideration, are there any persons who are being exempted from taking vaccines at this time?
Well, that's a good question. No? In the initial trials, the population less than 18-year-old and pregnancy patients during pregnancy, they were excluded at the beginning. No? There are no some trials that are including the pediatric population as well as some during pregnancy, but those are the groups of population that were excluded at the beginning.
Okay.
And what do we know about the vaccine's effectiveness against all of the different strains and variants that we've been hearing about in the news as well?
Yeah, that's a good question. No? The information we know so far is say that the new vaccines, especially the most common ones, no, the Moderna and Pfizer and Astra, they are effective against the new variants. No? The advantage to have this new technology is that it's easy to make some adjustments into the material in case of we face problems with some of the variants. No? It's easy to make adjustment for the vaccines in the future to be more effective.
But so far, I think we read that some of the vaccines are not proving to be as effective against the South African variant.
Exactly. The South Africa variant, the information is saying that some of the vaccines are not 100% effective, or at least the rate of effectiveness is not the same. And then that the reason why they are now making some adjustment, especially with the new technology, that is something that is more easy to be done, no? To make adjustments and to offer a better protection.
Yeah. But the South African variant how many countries has it been detected in, do you know?
Well, this is the South Africa variant as well as the Brazilian variant also. We are seeing in some other countries. I don't know exactly the amount of countries that have been reported, especially the South Africa variant.
Now, Doc, the rollout of the vaccine is going to be, within a few months. And one of the things I think that we keep on wondering is how much persons have to be vaccinated for us to feel like we are adequately covered to return to a new sense of normalcy.
Yeah, well, that's an important question, no? And I think so. One of the advantages of our country is that our population is not a huge population, and that's probably in that case should be in our favor, no? Of course, it will depend much on what is the agreement. I don't know exactly how much vaccines we are going to get through the COVAX program, no? But of course, they estimate at the beginning that it will cover 20 to 30% of the population, no? At the beginning, to trying to have the famous herd immunization that it will allow us to start to release some of the measures that we have and start in a way more safety open the country. No?
Yeah. And what do we know about how long these vaccines last?
In terms of effectiveness,
yes.
or the protection,
yeah.
We don't know as yet. This information, as you know, normally the vaccines is going to be followed for a period of time. No? I mean that we don't know as yet if we will need to have a booster in a year or in 2 years. That piece of information we don't know as yet.
Yeah, yeah. And what about people who have been infected with COVID before? Do they need to get vaccinated?
Yes, because the being infected with COVID, it will provide people with the time it varies, but an average of 3 to 6 months of protection and natural protection. But after that, you are going to be also in the same position and everybody else that you can be reinfected again. I mean that the recommendation is that even if you got the COVID, you need to get vaccinated.
And so, sorry, you said just now that if you have been infected with COVID, your natural protection will only last 3 to 6 months?
That is an average, that we know, right? And of course, we have now the ability to measure antibodies, no? To see, and I have a lecture of that and see. But despite of that, the general recommendation and what they are doing in other countries is that even that you get COVID-19, the recommendation is that you need to get vaccinated.
Do you have to be tested before you get vaccinated to ensure that you don't have COVID?
No.
No.
No. However, you can get even if I get vaccinated today with my first dosage, I can in a week or two I can develop the COVID-19 because it will take some few weeks for me to start to develop the immunity. No?
Yeah. I wondered about that. So if we get vaccinated, or you get vaccinated as a frontline worker, I mean, you have to take, after your first dose, all the precautions or even more for that vaccine to be effective.
Yeah, that's an important question. The fact that you are get vaccinated then is not give you a green light for you to start doing that we are doing, especially the social distancing, mask. We need to continue practicing social distances, and as you say, even more than with more precaution, because of course we are getting the vaccine, and it will take some few weeks for us to develop a proper immunity.
Even after the second dose?
Even after the second dose. We need to continue practicing our different measures to protect others.
Yeah. And what happens, let's say I've received my second dose of vaccine and it's a month later, so can I then relax on what I've been doing? Maybe not wear a mask, or why not?
So far, what we know already, again, the idea is to try to complete that, we call it the herd immunity, that most of the population is going to be immune. But at the beginning, as I say, we only anticipate to be able to vaccinate not the entire population, and then the idea is we need to continue practicing social distancing. We need to wear our mask and doing what we doing right now in order to prevent to get infected, but also if we relax, then the population they will think that the things are okay now, and probably they will doing the same. But the general recommendation is that we need to continue doing that until we have we trying to get the famous herd immunization for our population. But that it will take time, because of course we need to try to at least making sure that the more than 50% of get the vaccines.
Yeah. So help me understand. The vaccines are going to prevent the person who gets it from getting a severe form of COVID. So it means that they can still get COVID and pass it along?
Well, unfortunately, nothing is 100%.
Okay.
In medicine. No? I mean that if you tell me, Doc, I will get vaccinated and I'm not going to get the infection at all, that's not true. There are not 100% protection, but it will provide you with enough protection to at least to making sure that in any case you will get a mild form of the disease.
Yeah. And so that means that you would have to still be careful about contracting because you can pass on?
That's correct.
Okay, okay. Now, the World Health Organization has said that essentially COVID-19 will become endemic. In other words, it'll be a disease that maybe we hear about in seasons like flu, and vulnerable populations will perhaps always have to be careful about contracting COVID-19. How does that fit in with the current vaccination rollout? How do you explain that to people?
Well, what is happening to us is that probably as an add-ons, we always trying to making sure that our children have all his immunizations.
Yeah.
But also as an add-ons, we basically forgot that there are certain immunizations that we need to get. Like, for example, after 10 years old, every 10 years we need to have the tetanus and diphtheria vaccine that we call it the DT.
Yeah.
Also, if before COVID, just want to mention, before COVID, if you are a patient with heart failure or you are a patient with a kind of chronic pulmonary conditions, then you must have the pneumonia vaccine, as well as the influenza vaccine that we've been a little bit trying to practice the administration in the last years. No, mean that with the COVID, we believe that it's going to be the same. No, again, we don't know as yet if the COVID vaccine is something that we need to have a booster every year, every 2 years. We don't know as yet that part. But again, one of the things is being discussed that we probably need to have a vaccination very so often, that you will have the COVID-19 will behave like the seasonal flu, no? That we have seasons during the year that probably we will see more cases, not as bad as we saw at the beginning or at the end of the year, but in a more controlled way, we can say that.
So it's definitely advisable that people, when they get access to the vaccine, take it.
Definitely. And then just going back to what we were discussing, and I don't know if you notice, probably we need to have some data, but we don't see too much cases of the seasonal influenza like the years before. And one of the reasons is that we are wearing masks, and that helps us again to prevent and to reduce the number of influenza cases. I mean, that's a good example.
Yeah. And just, before we go, let's look at what's happening locally. I was asking you about your COVID-19 unit there at Healthcare Partners. You said that you have seen a drastic reduction in hospitalization.
Oh yes, we can say it's a dramatic reduction. We finalized the 2000 the year with we were at full capacity November and December. Just at the beginning of January, we start to see a reduction of cases. We start to send people home. At the middle of January, we essentially were with no cases. And not just recently, we have probably last 3 weeks we have one case at least, but no more than that.
Yeah. And what does that mean for you?
Well, whatever strategies were put in place and all the different information we are essentially sharing with the people, you as a social media and media, I think so is basically showing that it's working, and that basically the people adhering to the different recommendations that have been given them. Of course, as you mentioned, we have the coming elections, and the recommendation is that we need to adhere to those different measures. And as you guys mentioned before, celebration, no? That is something that we need to work, trying to making sure that we don't have any spike of cases in after the election.
So when you look at the next 6 months, you feel that we are headed on the path of seeing the beginning of the end?
Yeah, what's your prognosis?
Yeah, there you go. Yes, doctor, give us your prognosis.
Well, I think so. Again, probably we need to see what is happening in other countries, and especially Israel. And again, our population is not big, and I think so we can do many things. The most important part, I think so, we already, and the population already understand that COVID-19 is a serious condition. Is still around. Please don't relax yourself, despite that we mentioned that number of cases have been dramatically reduced. And of course, you see the news that also the main referral hospital of the country is also put in a different alarm way, because the surge of cases is not that bad, and they are actually using the regular entry of emergency now. It's just a signal that things are getting better, no? Yeah. But we cannot relax. Yeah. What we're seeing is that as soon we start our vaccination program, that is going to be an important help, and hopefully in the next 6 months we are going to be in a better position that we can slowly open the country, especially to the tourism. I think so we are open, but we can open with more confidence that we are doing the right thing, and we are going in the right direction.
And what
That's our.
Sorry.
Go ahead. Sorry.
No, I was just going to ask one more question. We still haven't gotten any information or the final results about whether or not any of the new variants have been detected in Belize. How do you think that's going to impact us if, in fact, we find out we have the UK, the Brazilian, or the South African, or another new variant in country?
Well, I think so. That information we will need to take it very carefully, especially because all the measures that we're implementing is showing that are working. No? Mm-hmm. I mean that. Despite of that, that we can recognize that we're probably exposed to the new variants. As we know already, the new variants are essentially more easy to spread, but we are seeing the opposite right now. No? Yeah. I mean that if those information or those material that was sent, I think so. It was sent for people a couple of months ago. I mean that we need to know what was the situation at that point, and what is happening right now. And of course, most important thing is what we are doing with people that are entry into the country. What the measure that we have in place at that point, and what we are doing right now, the difference, and if we need to do something different in case that we recognize that some of these variants are already in the country. That is not surprising, with the way we are traveling now. It's nothing surprise if we have some of the variants. No?
Well, Dr. Hidalgo, that is just about all the time we've got for this morning's conversation. So we want to thank you for coming in and sharing your perspective and sharing a lot of this important information with our viewers.
No, thank you. And you guys have a nice day, and for all the population, let's keep in practicing our measures because it's working, and then we need to continue doing the right thing, moving in the right direction.
Thank you, Doc.
Yep,
Thank you.
Yep, thank you. And with that, we are going to be taking a break. And when we come back, we are going to be giving you our Meet the Mayoral Candidates segment. So please stay tuned, and we'll be right back after the break.
This COVID update was brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.